Barrister Chodola Wayne, the Secretary of the State Government, Professor Solo Choku. Okay, thank you very much. The Executive Council of Anambra State, House of Assembly here, I greet you all. The President of Mathematical Society of Nigeria, my father, and Ayuba Tanko Ibrahim, FPSN, Dr. Ueno Waga, FPSN, Chairman of Board of Trustees, Past President Anthony Ahime, Past President Africa Okwo FPSN SFFP, Past President Olivia Kinchoya, Past President Professor Sri Osiko, the Registrar, the Chairman, all protocol rules have because of time. But I must also respectively introduce or recognize my mentor, because whatever you are today or whatever you do anywhere in the world must start from somewhere, from your home, from your family, from your mentor and your role model. My mentor, Chief Honorable Dr. Sir Kamakasi Iwoye, PhD COS. Distinguished colleagues, ladies and gentlemen, on behalf of the Association of Community Farmers of Nigeria, I'll make a statement today on the contemporary issues, and I have a two-segment statement I want to make. It's going to be somehow historical, but standing on behalf of you with the permission of my father, the PSN President. I recall in 2015, at the height of the civilizational crisis on the state of drug distribution in Nigeria, stakeholders in pharmacy sector rely on the coordination of the PSN, and this gives birth to the National Drug Distribution Guideline (NDG) 2015, which was subsequently approved by the Federal Ministry of Health, and the PCN and NAFDAC endorsed the initiative of the PSN-led pharma stakeholders. The draft of CWC philosophy was synthesized at the PSN National Secretariat and was subsequently adopted at PSN National Council. Since 2015, the Federal Ministry of Health, during the request to actualize the CWC option, would have stated to take off initially in Lagos, Abia State, Anambra, and Kano States. Subsequently, the ASIC and Adewale-led Federal Ministry of Health in 2019 further approved that open market in Enugu, Oyo, and Borno states should embrace the CWC option. Of the 7 states earmarked for the CWC profile, Kano State is the only state where 100% success rate has achieved to date. We must commend the Kano State government as well as the Pharmacy Council of Nigeria and National Agency for Food and Drug Administration and Control (NAFDAC) for ensuring the complete relocation of operators of servant-building markets Kano to CWC located in economic city in the Korea town of Kano State. This brings me to the solution effect, the actualization of new realities in the health system, and more specifically, the pharma sector. Perhaps I need to give some background on why Anambra State government continue to make footprints in the sand of time in the health care in the last 3 years in particular. The Slow administration has emerged as the most pharmacy friendly in Nigeria. Today, the notable appointment to pharmacists, including the reflected pharmacist Tori Onyeka, FPSN Commissioner for Housing, pharmacist Dr. Godwin Nnadozie, FPSN Special Advisor to Governor on Medical and Pharmaceuticals, pharmacist Dr. Harrison Evan, Senior Special Assistant to Governor on Medical and Pharmaceuticals, Farm Dr. Obiageli Uchebo, FPSN Permanent Secretary of Health, Anambra State, Farm Chisomuche, FPSN Executive Secretary, Anambra State Farmer United Agency. Can we clap for our Excellency? We put on record the progressive side of Anambra State in the health sector. With Professor Charles Olulo allowed to evolve with a full complement of the health team. In the annals of primary health today, the Anambra State Primary Health Development Agency showed that the member as #1 agency in both the Southeast and Geographical Zone nationally in the ranks of the 36 states of the Federation and the FCT. Acpn and pharmacists now the governor of Anambra State for his health setting methodology, which confirmed that if you allow a truly broad spectrum concept to rule the affairs of health sector, the results are bound to be positive in the interest of consumer of health. This then brings me back to the second matter in CWC project, with a special focus on about CWC, which is gathering some momentum. We have gathered that the Anambra State government is fully committed to providing adequate infrastructure to position that facility to have an adequate environment through the untiring effort of special advisor to the governor on medicals and pharmaceuticals, senior special assistant to the governor on medical and pharmaceuticals. As we gather in Oka, 70 years after our last conference in Oka, we salute the count of Governor Soludo, who is committed to the smooth takeoff of what must become a most strategic CWC in Nigeria. We especially thank Anambra State Governor for recently facilitating the allocation of some short parcel of land to our industrial pharmacy to enable them to line some professionally inclined deliverables, including some levels of research, laboratory tests, cold room storage, and others at the CWC. We have no doubt that Association of Industrial Pharmacists from Nigeria is adequately to live up to the expectation. You will permit me to conclude this segment by thanking the Executive Governor of Anambra State, Professor Charles Olulo CFR, the government for the well-appreciated support extended to Acpn to make this conference a success story. I want to assure Your Excellency that we don't take their support for granted. So the Acpn will continue to maximally collaborate with the Anambra State government to achieve best result possible in the public interest. I want to make another statement on NAFDAC pronouncement on operators at Edumota, Ariala, and Headbridge markets. The Acpn observed with distress a recent directive by NAFDAC decreeing all the operators in the recently sealed Edumota in Lagos, Ariala in Aba, and Headbridge market to register the NAFDAC on certain portal for national database. In a season of aberration that have pervaded the health sector in recent days, we find this unlawful directive too difficult to ignore. The two principal regulatory agencies in the drug distribution brackets of the pharma sector have their clear-cut statutory functions. PCN has a certain approbation in law to inspect and register pharmaceutical premises, engage in retail, wholesale, importation, manufacturing, safety officers, scientific officers, patent medicine, vending, and satellite pharmacies. There are over 15 court judgments from the Federal High Court in various states of the Federation, which validate the mandate of PCN in the regulation and control of pharmaceutical premises in Nigeria. Specifically, all the Federal High Court judgments are unanimous. PCN has a strict appropriation in law to regulate and control the pharmaceutical premises in all states. In all states. All associations, both in public and private sectors level, including the private and hospitals. In similar way, NAFDAC, by the invention of Section 5 of the Enabling Act, has power to regulate and control the sales and control of marketing of foods, drugs, medical devices, and water. There is no law in Nigeria that gives NAFDAC power to legislate premises in Nigeria. So it must desist.
And the resurrection with our own vision for a new Anambra State, one where technology, human capital, and smart healthcare coverage converge to technology is everything. Now, I heard you commend us for what we are doing in the area of telemedicine, the area of storage, the area of digitizing the record system in our hospitals and healthcare delivery. I said, technology is everything. With technology and with the advance of artificial intelligence and so on and so forth, the practice of healthcare delivery will be totally a different stage in some years to come. You guys are the front line of it all. And for us here in Anambra, you have already mentioned and acknowledged that I don't want to bore you. We are very, very intentional about delivering health care to the person who needs it the most, to the forgotten, to the neglected, to the rural communities, to the, especially the vulnerable ones. And that's why we prioritize our primary health care service delivery. Trying to, improving the infrastructure in the 326 electoral wards that we have. Within the first 9 months when I came, we recruited over 1,000 healthcare professionals, consultants, doctors, pharmacists, nurses, and so on, to end the era of medical facilities without medical professionals. We are drilling down, we are even going into the next phase of still strengthening this primary healthcare system. I was looking at a file last night in that respect, and we are going to be wrapping that up, able to do more. Yes, you may have heard that in the National Healthcare Challenge, Primary Healthcare Challenge, that Anambra State was decorated as the Southeast Regional Champion. We won a cash award of 500,000 for that. And following that, we were also decorated as the National Champion. And we won another cash award of $700,000. Maybe I shouldn't be able to say this because I remember somewhere I said it, somebody said, can we have a cup of the prizes? But this is for us to help to deepen the healthcare delivery system. So for us, we are very, very intentional about, because health is wealth. Health is wealth. And the pharmacists happen to be at the heart of the healthcare delivery system as well. You've talked about our trauma center, digitalization, record keeping, and so on and so forth, drug management system, and so on, the legal framework for all of this in place. And eventually, the ecosystem that we are developing in terms of the nexus between the manufacture and the distribution. And this is where the wholesale drug thing, we have the largest open drug market, they say in West Africa. I don't know whether that is true, with the Onisha and the virus axis. But that's why we are intentionally developing the pharmaceutical manufacturing hub, nearby, so that you can connect the dots between manufacture and wholesale distribution. We want to position to really be at the heart of it. But it's not just to produce and distribute, but we also want to ensure that whatever anybody is going to get out of here, this is where we need your help. We would like to ensure, whether it is you regulate the premises and make sure they do the right thing. Now that regulates the quality of what is produced and so on. I don't know who does what. You guys sort those out. What we can, and we want to believe that our target, our game, is that whatever is produced in Anambra, pharmaceutical company operating in Anambra, that Anambra will be synonymous with the world standard in pharmaceutical output. our vision. Drugs that are manufactured here, drugs that are distributed from here, will have the insignia of world-class quality. And only you pharmacists, will help us to accomplish this. You will help us. We look forward to that partnership, to work with you. Whether we are designing the pharmaceutical industrial hub, its practice, its supervision, the wholesale distribution hub, its practice and supervision, we will need to work with you all the way to improve the lives of our people. Finally, I want to welcome you as you've come in here. You've come in at the middle of the week, so to speak, but I'm excited that you are staying all through to the weekend. Because all pharmacists, you get into the hospitals, you are wearing all this, your overall, and doing this, and blah, 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 having calls in the evenings and in the nights. And I want to hope that in the midst of this, you are going to find time. You are going to find time out of your hotel room and stretch a little bit. If you are not in Abakaliki Street, no, if you are not there, whether you are there or not there, I can see the executive secretary of our primary health care saying Fun City. I'm sure she has already planned some calls and so on to take you in batches to go around there. If the president is going to be doing some swimming, I will come and join him. You know, so welcome you. Just take a look. Hopefully by next year when you come, it won't just be the Fun City and the country club and the other few things that will be in place. We'll be able to be taking you around places. If you don't say, do I go here, or do I go there, or do I go there, do I go there? And then, because we're also intentional about making Anambra a destination of choice, no longer a departure lounge. That's our vision. Anambra as a destination of choice. A place to live, invest, walk, relax, learn, relax, and enjoy. Life is to be enjoyed. You gotta have fun, leisure, and pleasure. Anambra is the goal. So we look forward to hosting you again next year, and I look forward to the partnership with the pharmacists. Medical doctors, you are doing your own part. The pharmacists are doing their own part. And the nurses are doing their own part. All the people in the health ecosystem are doing their respective parts. Let's work together and to give our people a sound, solid, reliable, dependable healthcare ecosystem. It is on this note that I then finally, it's my great pleasure by congratulating the Acpn for this wonderful event, and congratulating all of you and welcoming all of you once more. It is now with gratitude for the honor to serve as your chief host that I declare the 44th annual national conference of the Association of Community Pharmacists of Nigeria open. Thank you very much.
Thank you so much. realizing its potential or widespread acceptance and adoption becomes key. I am aware that the Acpn have launched a health app as a form of digitalization. I'm hearing that there is very little acceptance or moderate acceptance and little adoption. Why is this happening? Number one, there is just that resistance to change. Some pharmacists fear that automation and AI will reduce their professional autonomy or even threaten their job security. Others are hesitant because of the unfamiliarity with new technologies. That is, they have very low digital literacy. Some are concerned about data privacy and cyber security. Some worry about the value proposition and the impact of the overall bottom line in their business. A significant percentage does not just feel ready to try new things. Let's not also forget that patients too may be wary of digital health solutions, especially our older patients and those with limited digital literacy. But building trust requires transparent communication on how this data is used and safeguarded, and demonstrating that technology complements rather than replace human care. I am sure some of us have common here, have common amongst ourselves. This is easier said than done. I agree with you. But I assure you, what I'm saying is not really academic. It is the future, and it is now. Digitization of pharmacy practice faces several challenges. Infrastructure limitations. Our regulatory framework tends to always lag behind innovation. I'm sure you are all aware that the 2021 online regulation, online pharmacy regulation came out years even after online prescribing and dispensing had already started. Cost is a significant benefit. It's a significant barrier. There was a certain time getting solar systems into community pharmacy was almost unimaginable. But now I cannot count how many community pharmacies do not adopt solar systems. Yes, it can be capital intensive at the first instance, but over time it has proven to be what? Cost effective. And that is the same thing with digital health support. Even the workforce capacity, it presents challenges. Most community pharmacies must develop digital competencies along their clinical skills. And this is one of the things I want to say thank you to Acpn, CPI, where they have had this as one of their core mandates. But to overcome these challenges, we need to have targeted education and training programs for both pharmacists and their clients. And it requires a coordinated action from professional bodies, government stakeholders, technology providers, educational institutions. There is need for policy frameworks to evolve to support the reimbursement of tech-enabled services, data sharing standards, and ethical use of artificial intelligence. As I close this keynote address, let me mention the opportunities that are still out there for us to tap from. Despite these aforementioned challenges, the opportunities offered by technology in community pharmacy is still very vast and is transforming. With the rapidly changing demographics of the digital age and people's changing disease-seeking treatment behaviors, the digital community pharmacists should thrive easily in such spaces. Very soon, ladies and gentlemen, there will be limited numbers of community pharmacies, but more numbers of drug pickup stops, locations. People are going to start picking up their drugs because they have conversed with the pharmacists through telemedicine or through telepharmacy or telehealth. Digital platform also enables community pharmacies to extend their services beyond traditional operating hours and physical locations. Data analytics and AI, artificial intelligence, facilitates more precise medication management, identifies adherence gaps, prevents adverse effects, tailors the therapy to the particular patient. Pharmacists can also leverage technology to engage in public health initiatives, such as vaccine registries, antimicrobial stewardships, and chronic disease surveillance. Moreover, technology opens an avenue for new revenue streams and professional roles for pharmacists. As we are beginning to seek for pharmacogenomic consultants, health IT leaders are being needed right now. By embracing these opportunities, community pharmacists will remain indispensable players in the evolving ecosystem. In closing, ladies and gentlemen, as we reflect on the key themes in this address and participate in the technical panel tomorrow, where we shall look at the practice of adoption of these digital health technologies, I urge every community pharmacist to see him or herself as a digital health leader. As key professionals in health, we must embrace continuous learning, personalized care. Also, all get towards universal health coverage. By doing so, we will not only safeguard the relevance and the vitality of our profession, but we will also profoundly improve the health and well-being of our communities. Ladies and gentlemen, we are living in a very rare moment. A moment where technology is powerful, patients are more empowered, and the value of accessible, personalized care has never been more clearer. Acpn, let us not be passive observers, else we will pay dearly for it, as we have done in the past. Let us be architects of this future, because the future of community pharmacy is not coming. It is already here, and it is ours to shape. Thank you very much.